Bismillahirrahmanirrahim. I welcome all of you in my today's lecture that is about the effect of the prone ventilation on oxygen saturation in COVID-19. So we are having a diagnosed case of COVID-19 and the patient is not maintaining oxygen saturation. So if we change the position, what will be the effect on oxygen saturation? Well, I have seen a lot of the patient is not maintaining oxygen saturation. When we change the position, the oxygen saturation is improved. So what is the concept behind that? And is it only the prone positioning that helps in the improvement of oxygen saturation, or there is another position or maneuvers also that can help us in the improvement of oxygen saturation? So a patient was not maintaining oxygen saturation on the room air, you put the nasal cannula. On the nasal cannula, the patient is not maintaining oxygen saturation, you change that with the face mask. If with the face mask the patient is not maintaining oxygen saturation, you change that with the non-rebreather mask. Even if with the non-rebreather mask the patient is not maintaining oxygen saturation, or you are having no resource, like you are having no non-rebreather mask and you are having only face mask, or you are having nasal cannula, you can apply these maneuver to improve the oxygen saturation. And this is all the game of the VQO mismatch. If there is more VQO mismatch, there is decreased oxygen saturation. If there is less VQO mismatch, there is improvement in oxygen saturation. Let's suppose this is the cross section of the chest of the patient with COVID-19. We know that COVID-19 loves periphery in the posterior portion of the chest. It relatively spares the central portion and the anterior portion. So we will compare. This is the supine position. The patient is lying supine. So this is the posterior portion and this is the anterior portion. So we are comparing the alveoli and the blood vessel of the posterior portion and the anterior portion in supine position. So this is the alveoli from the periphery or posterior portion. So there is fluid due to infection. There is exudate. There is infectious material, and also there is a phenomenon of thrombosis. So there is decreased air. Do you think the oxygen can jump and cross this barrier of infectious material and enter into the blood to improve the oxygen saturation? No. And also there is thrombosis. There is less amount of blood coming toward the alveoli. So there is decreased VO, there is decreased QO. So there is maximum VQO mismatch. If there is maximum VQO mismatch, so there is no oxygen saturation at all, or very less oxygen saturation at the periphery or the back. Now this is the alveoli and this is blood vessel from the anterior portion of the same patient. What happens? In this, all the blood is shunted toward the posterior aspect of the chest. Why? Due to the effect of the gravity. Due to the effect of the gravity, all the blood comes toward posterior portion. The anterior portion has less amount of blood. If all the blood is coming toward the posterior portion, like that, in the posterior portion there is a large amount of blood, but the alveoli are infected. The alveoli has infectious material. So virtually we can say there is no air coming toward the infected alveoli. So whatever the amount of blood comes to these infected alveoli, do you think these alveoli can saturate this blood in the blood vessel? No, because the oxygen cannot cross that barrier. Whatever the amount of blood is there, it is not going to be oxygenated by these infected or ill-health alveoli. And if we take this portion from the anterior aspect of the chest in the supine position, there is air. The air is coming toward the anterior chest. But what is the blood? Blood coming toward these alveoli that lie in the anterior portion in the supine position is less. If there is less amount of blood coming, there is less amount of gaseous exchange. If there is less amount of gaseous exchange, there is decreased oxygen saturation. Now what happens if we rotate this patient to the prone position? In prone position, what happens? All the blood comes toward the anterior aspect. All the blood comes toward anterior aspect. So the blood is shunted toward the healthy alveoli. In the anterior aspect, we were having healthy alveoli. There were air coming toward the healthy alveoli, and the blood is also coming to these healthy alveoli. So the blood is taking oxygen, and that is oxygenating, and the oxygen saturation is improving, and there is decreased VQO mismatch, and there is maximum oxygen saturation. So by changing the position, we have diverted the blood under the action of gravity. We have diverted this blood toward the healthy alveoli, and the healthy alveoli were already having maximum amount of air. But there was less blood coming in this position, but there is more blood coming in that position. We have minimized the VQO mismatch and we have improved the oxygen saturation. Now, suppose this is the X-ray of another patient, and he is having only right side infected. What happens? What is the ideal position for this patient who is having on the X-ray the right side is infected, left side is spared? What is the ideal position for him to be having maximum oxygen saturation? This is right, this is left. Do you think he should be lying in the bed on the right sided or left sided? The answer is left sided. The right sided should be above. The principle is that the infected side, the side that has opacity on the X-ray or the CT scan, that should be above. Why? Because if that is below, what happens? There will be maximum blood flow coming toward this area. If the maximum amount of blood is coming toward the infected alveoli, the alveoli which cannot cause gaseous exchange, there will be no improvement in the oxygen saturation. But what if we keep this patient on the left sided, the right sided is above? What happens? All the blood would come toward the left side. If all the blood come toward the left side, what will happen? We are having healthy alveoli over here. If the blood is maximum, alveoli are healthy, we are having maximum oxygen saturation, and there will be decreased VQ mismatch. Suppose we are having CT chest of a patient whose interior side is infected. What is the ideal position for this to improve oxygen saturation? Supine position. Why? Rule is infected side should be above. Why? Because all the blood under the action of gravity comes down toward the healthy alveoli. So the healthy alveoli, if they are supplied with the blood, what happens? There will be the decreased VQ mismatch. So there will be increase in oxygen saturation. So this is all the game of this VQ mismatch, and you have to keep the infected side above. If interior portion is infected, we have to keep the patient in supine position. If posterior side is infected, we have to keep the patient in prone position. If the right side is infected, the patient should be laid on the left sided. If the left sided, patient should be laid on the right sided, so that under the action of gravity we divert and churn the blood toward the healthy alveoli, so that there is decreased VQ mismatch and there is increase in oxygen saturation of the patient. Thank you for watching.